I'm going to be going over an X-ray example and the progression of the bunion procedure and the bone healing. This is a pre-op X-ray for a patient who has a severe bunion. Normally these patients don't qualify for a head procedure, meaning procedure in this area, because the angle between the first metatarsal and the second metatarsal is too large and the joint is too, we call it sublux, or it's too dislocated. These patients usually require a procedure done at the base of the bone so the bone can be corrected. If the procedure is done at the base, these patients have to go into a cast for up to 4 weeks, and the procedure is very invasive. The incision is long. Most likely it starts from this region and all the way down to this region. So with my advanced minimally invasive bunion procedure, I have found out that I'm able to perform this procedure at the neck region of the metatarsal, which will make this procedure very stable, and these patients can continue wearing a surgical shoe and be able to walk the next day. This X-ray actually belongs to a professional dancer who was not interested in invasive surgery and definitely not interested in procedures that are done at the base, which normally requires a fusion of this joint. That would be a different topic for a later video that I will be doing, which we will get into a more in-depth conversation of that procedure, which is called the Lapidus. Today, I'm going to show you how I performed the surgery, and we will be showing you the X-ray findings of the pre-op, immediate post-op, 4 weeks later, 8 weeks later, and 4 months later, so you can see the progression and how the bone heals and how we were able to realign this joint with a head procedure, which did not require the patient to go into a cast, and she was weight bearing immediately post-op. Okay, so with my advanced minimally invasive bunion procedure, I do make a small incision in this region. The incision is about 5 millimeters, and I introduced a small saw or a chisel or a burr to cut the bone in this segment, which is, I'm going to perform that right now in this program, so you kind of get to see the area of the operation. So once the bone is cut, I'm able to move the bone basically from this segment, moving it all the way up to this segment. And as I am moving the segment of the bone towards the second digit, the toe will start coming around. I also do perform a release of the tendon here, because the tendon at this point is not functioning properly, is over pulling the toe. It requires a release so that way this toe can come back into a normal position. Also going to mention that this bone, this small bone, and the one right next to it are called the sesamoids. Normally the head of the metatarsal, the area that I have selected, should be right over these two sesamoid bones. That's the normal position of the sesamoids and the normal relationship of the sesamoid to the head of the metatarsal. As the bone is cut and shifted over, that's what I usually pay attention to. I move it as much as I should. I don't really pay attention too much about the bone-to-bone contact. That's something that we cared about in a traditional bunion surgery. Most often we said up to 40% translation is the limit of the Austin or the chevron bunionectomy. But in my advanced minimally invasive bunion procedure, I have pushed the limits all the way up to 90% translation, which is something that you're going to see in this procedure on this patient. This is basically what you see after my procedure. The bone is cut in this region. and the segment of the bone was pushed closer to the second digit, reducing the angle between the first metatarsal and second metatarsal. And as you can see, the sesamoids are now in good position. I usually fix my osteotomy or my bone cut using a cannulated screw and a Steinmann pin. I use 2 stabilizing forces, that way the bone is not tilting and also it's not rotating on its own. About 4 to 5 weeks later, I do remove the Steinmann pin, which I will be showing you on the next slide. Right here, the Steinmann pin was removed, and as you can see, again, I have really pushed the limits of my own procedure. I have made about 90% translation. The bone will heal because this procedure is not invasive. We're not dissecting a lot of tissue here. It's only a small incision which cuts the bone, and I will translate the bone laterally. About 4 weeks later, after the Steinmann pin removal, which is about 8 weeks after the bunion procedure, you can see some signs of bone healing appearing in this area. This is the time that I usually tell the patient that the bone healing is adequate and they can start resuming back to normal activities. In the next segment, you're going to see complete bone healing, and the screw was also removed. And as you can see, the alignment between the first and second metatarsal, this angle between the two, are back to normal. Now I'm going to show you the clinical picture of the patient before the surgery and after the surgery.